of need that still exists out in our communities, and we are working every single day to work to meet that. But it is a moment also to reflect on where we were a year ago compared to now, and what that tells us about the types of supports that the city will need from other partners as well to actually get this done. I think the most important numbers that stick in my mind are around the impacts that we've been seeing with uptake of treatment and services when there is stable housing. So last January, well, starting long before, but in January of last year, nearly 200 low threshold supportive housing units came online that the city of Boston works to fund, site, and connect to residents in need. Those nearly 200 housing units, 192 units, have, for the residents who've been able to access them, had amazing results. Right? The percentage of individuals who we're seeing sticking on a treatment plan, making it to appointments, and even then moving on from this kind of transitional stage into permanent housing outside the city has been, compared to what the percentages look like for someone who is living on the street or in a tent, it's night and day. And I know some team members can add some more data to those points. However, with these 200 units, 192 units, we've been able to see 65 people go all the way through from that medically supported low threshold housing, stabilized enough to access permanent housing outside the city, and new residents then taking their spots in that low threshold housing to get on their feet, and some even cycling through multiple times as these units have helped people get that footing and move to the next phase of their recovery. The reality is that as we've been able to serve these hundreds of residents who have gone through the housing and treatment pipeline with us, hundreds more residents have arrived from other cities and other states even. It is not uncommon when I am at the engagement center and out and about in the area to meet folks who have come from the New England region writ large and not just within Massachusetts. And so the need is there. We know that this works for stabilizing individuals, but at the city level, with the funding that we have, with the resources that we as a municipality have, cannot do it alone. And so our call, our ask, and the result of what we have learned throughout all of these 10 months and how to do this and how to do it right is that we need partnership from the state. We need 1,000 more units of low threshold supportive housing to be created and sited outside the city of Boston. We have 200 units right now. We are working through identifying more locations and increasing that number every single day. And so we will keep doing our share as the city that is a hub of services and welcoming to all. But to truly address the level of need and the depth of the opiate crisis, confounded and complicated with homelessness and mental health, we need the state as a partner, as we do on every issue. And so we're eager to provide that expertise and really be clear about the results that we have seen with these 192 units and the partnership and collaboration from all of our departments. The number of individuals gathering in the area has gone down, although it is still large numbers. The number of tents that are there have gone down, although we still see them popping up every day and work to take them down every day. We have added transportation that is free to connect individuals to other service and daytime spaces throughout the city. We have worked to change around the services being provided at the engagement center and hours that is being offered. And Dr. Ojikutu and her team are really diving in on case management so that we will be able to help triage at the city level, adding staff to connect people directly to services and housing that's available. But we simply cannot sustain a model that we know works of providing housing to be that stepping off point and stabilization point for services to house the entire New England region. And so we're looking for that partnership from the state and eager to share a little bit as we're moving into the colder months about what we're preparing for as the weather grows more dangerous again for individuals who are living on the streets, working with our shelter partners and emergency overnight spaces to expand capacity and be able to receive that. But every day this team is trying new strategies, housing more residents, working their way through the wait list that we have, seeing amazing results with the individuals who have been able to connect with that team for case management and services. But it's time to be thoughtful about how widespread a situation this is across the entire state and region, and to provide the framework now that we can build on with the state as a partner to see this succeed across the Commonwealth. So I'm going to hand it over to Tanya Del Rio, who's the director of our coordinated response team. She'll be followed by Executive Director Dr. Basola Ojukutu, Commissioner Cox, Chief Sheila Dillon, Superintendent Brohl of Public Works, Commissioner Woods of the Parks Department, and then Sue Sullivan.
Thank you, Mayor. What I want to do is expand a little bit and provide more information on the activities that have been going on in the last few hours. But first and foremost, wanted to thank community members for their stewardship of all our public spaces, including our streets, our parks. Your collaboration is crucial and has been really appreciated. I also wanted to thank the many people who are on the street, staying there, facing lots of challenges, substance use, homelessness, mental health challenges. Yesterday they were able to collaborate with us and in an effort to provide the safest and most healthy environment possible for themselves and the rest of the public. I'll provide a little more detail on that, but I really did appreciate their building trust with all our teams and their collaboration. I also wanted to thank Mayor Wu, Mike Firestone, and all of the teams that are standing behind us for their support and for their presence every day. The mayor has a firm grasp on all of the nuances that are involved in facing this challenge, and it's just very much appreciated that she's present and providing this leadership. I wanted to share with everyone just a reminder that the city's approach is public health led, equity focused, and the goal and the vision is to connect all people who need services to the appropriate resource that they need. We wanted to also share that one of our principles is to be providing transparency, and as we are monitoring the situation really closely, you, the public, are able to do that with us too. If you just go to boston.gov/massCASS and click on our dashboard, you will see the count of our number of people present and a number of different other metrics that my colleagues will speak about, so that you can follow along with our progress. And as the mayor said, the challenge and the level of need is high, but we do want to share very transparently what's working, what's not working, and have a fact-based, numbers-based discussion with you, the public. So I'm going to go ahead and expand on yesterday's activities. As part of yesterday's shift was part of our ongoing daily work, as we go ahead and every day adjust to see what may work, what are the ways in which we can connect people to services most effectively. And we wanted to address two specific things, with asking people to congregate not on Southampton Street and instead ask them to frequent Atkinson Street. The first one is addressing traffic safety. We had seen a number of close calls with people getting in traffic, close to traffic. Both the concerns are about members of the public, about community members, and also staff. And we believe that the transfer to Atkinson Street is really going to help us address that specific traffic safety issue. We also have heard good feedback from teams about our second goal, which is to facilitate case management. There are people from a number of organizations on the street providing case management, providing medical attention, and they have shared with us that this move is going to be able to facilitate that process for them. So we were able to accomplish those two things yesterday with the move to Atkinson Street, while acknowledging that the challenge that is mass and CASS remains, and we are at work every day addressing that. I also wanted to share that we're going to be closely monitoring the situation in the coming days. As you can imagine, some of the things are maybe unpredictable, so we have staff members present there, have been present overnight, will be present as we always are in the coming days, with a strong focus on just monitoring any changes that we observe. You will hear today from Public Health Commission, from the Police Department, from the Mayor's Office of Housing, from the Department of Public Works, our Parks Department, and our partners at the New Market bid. The Mayor's Office role is to coordinate all of these teams, work together in a collaborative way, and adjust as we go, remain flexible, so that when the situation changes, we're able to respond effectively. We're always able and willing and eager to receive your feedback, so please direct that to me. I'm always available to answer questions, and like I said, eager to receive your feedback. Thank you all the teams for your ongoing collaboration and your presence today, and I'm going to hand it to Dr. Bisola Ojekutu from the Public Health Commission.
Sorry, before Dr. Ojekutu, I think everyone caught this outside, but I wanted to recognize my colleagues in government who were here as well. So thank you to City Councilor Aaron Murphy, City Councilor Frank Baker, and Michael Flaherty, and State Representative Liz Miranda.
So good afternoon, everyone. I'd like to thank this team and Mayor Wu for continued leadership in addressing substance use disorder and their commitment to responding to this crisis through strategies that are evidence-based and providing clinical support and public safety interventions. So I just wanted to start by giving a general overview. I mean, almost every city across the U.S. has a mass and CASS. What we're experiencing is a result of the devastating impact of substance use disorder, mental illness, and homelessness on people who are frankly vulnerable. So if you look at our data in Boston, and I'll just talk a little bit about what's going on both in the past and present. In 2021, 243 Boston residents lost their life to opioid overdose. A similar number died in 2020. Unfortunately, we don't have mortality data yet for 2022, but our goal is to have enough interventions in place so that we will see a downward trend. What we know, though, is that some progress has been made in terms of individuals on the streets in Mass and Cass, as well as tents on the street in Mass and Cass. If you look at the same day in October 2021, there were 262 individuals walking around, existing on the street in the Mass and Cass area. That same day, this year, October 2022, there were 90 people. Excuse me, there were 173 people. So 262 versus 173. And if you look at the number of tents in October 2021, there were 90. And now, the same day, October 2022, there were 20. So that's actually 70% fewer tents. So we have made significant progress. I think it's important to think about progress, and it's important to pay attention to these data as we move forward. And so we'll be continuing to collect this data, and we'll try to be as transparent as possible as we collect it. Within the last 2 weeks, we conducted a survey of 150 individuals congregating on Mass and Cass, and we do have some preliminary data from that survey. There were approximately 59% men on the street and 36% female. We do continue to note significant racial and ethnic diversity, with 31% Latinx individuals and 25% Black or African American individuals. And approximately 47% have been coming to Mass and Cass for 1 year or less. So many of these folks were not here in January 2022 when we did the initial housing surge. And 50% have nowhere else to go, so they're unsheltered and living on the street. So here in Boston, we're confronting these challenges. Approaches. This is critical. We don't have one solution to this problem. No one does. Congregate on Mass and Cass Atkinson Street, out of the danger of traffic on Southampton, will make it easier for our outreach teams to engage individuals, to reverse overdoses, to distribute harm reduction supplies, and to ultimately help more people. We'll also be expanding our case management services because addiction affects so many facets of people's lives, and we need a comprehensive set of solutions to offer folks. These expanded case management services will be based at the Engagement Center and will help increase linkage to counselors and recovery services. We'll be reuniting individuals with family members, and we'll refer people to services in their hometowns, those individuals who are not from Boston who are living in the area. And that's important because we should not be bearing the burden of what's happening here alone. This is a statewide problem, and it is a regional problem. I think this is also going to increase our ability to provide housing navigation. Our goal from day one has been to support the needs of this highly vulnerable population while reducing crowding, improving safety, and promoting sanitation in the area. And housing is a critical piece of achieving this goal, and you'll hear more about that from Chief Dillon. But I do think it's important to note from a clinical perspective that as of August, 7 months post our tent to housing initiative, 50% of individuals who are housed are taking medication to treat opioid use disorder. 64% are engaged in primary medical care, and approximately 30% are engaged in mental health care. These individuals are on a road to recovery, and we're continually working to improve engagement in these critical services. In addition to housing, we've also opened 2 new day spaces where people can access services and other supports. These spaces are located outside of Mass and Cass. They're in Back Bay and Roxbury, and they're operated by our partners, Victory Programs and Whittier Street Health Center. These resources will increase the city's capacity to provide recovery, harm reduction, and healthcare services to individuals who are experiencing substance use disorder. So lastly, I just want to say a few words about harm reduction, because it is such a critical piece of what we do. So since 1994, the Commission has operated a state-funded syringe services and harm reduction program that's really made life-saving resources available to residents across the city. HIV, viral hepatitis, and other bloodborne pathogens pose a serious threat to the health and safety of people who use drugs, as well as others. And if not addressed, these infections could create a larger public health crisis than the one we're dealing with currently. Harm reduction tools mitigate this risk, and it's a critical part of our work. And decades of research and evidence support its efficacy. I think that we understand the concerns about syringes, and we take these concerns very seriously in our parks and streets. Based upon our most recent data, which is available on our dashboard, if you look at data since January of this year, we've collected 2.7 times the number of syringes that we've actually given out. So over 200,000 syringes have been taken in versus 73,000 that have been given out. And that's been done through our AHO program, our Access to Harm Reduction, Overdose Prevention, and Education, as well as our Mobile Sharps team. So through harm reduction, we're getting syringes out of communities, and this is really important. I think, like those other individuals with other chronic diseases, people experiencing substance use disorder deserve a chance to get better and to know that their health and safety are valued. The Boston Public Health Commission, in partnership with Mayor Wu, the other city agencies represented here, other city leadership, will continue to work towards our goals in a manner that emphasizes equity, affirms dignity, increases access to care and treatment, and promotes recovery. Thank you.
Good morning. The police department is certainly here to support the city in all its efforts to deal with this public health-led issue here in the city. And we have a lot of issues in the city, and this is certainly one of them. And we will always partner to support any efforts to make the city better. We will continue to spend all the resources necessary, particularly on our outreach teams, to make sure that we're successful in this endeavor. Our presence and work and efforts is focused on the issues discussed here are important, and the officers, as I described before, will do everything we can to address crime and fair crime related to not only this issue but all issues in the city. And Chief Dillon is up next. Thank you.
Thank you, Commissioner. So for those that don't know me, my name is Sheila Dillon. I'm Director of the Mayor's Office of Housing, and we've been working closely with the Boston Public Health Commission on the management of the 6 low-threshold sites that the Mayor referenced. These 6 sites were set up to get those living in the Mass-Cass area off the street, first to stabilize these individuals and then work with them on housing and recovery pathway. And I just want to take a quick second to thank those that helped us set up these sites. We have a really significant network of caring nonprofits: Boston Medical Center, Victory Programs, Elliott Human Services, CCA, St. Francis House, Pine Street Inn, Boston Healthcare for the Homeless, and of course the Boston Public Health Commission. They set these sites up under very difficult conditions, making them a welcoming first step for those that were living on the street in the Mass-Cass area, and for individuals that had many, many obstacles and were dealing with many, many issues. As you can imagine, this work has been difficult. However, as been stated by the mayor and others, we are making progress. I want to provide you some information on the housing efforts and just to illustrate what the mayor said, that these sites are indeed working. As of yesterday, and the mayor used a number 65, I've got a little updated number as of this morning, so progress is being made daily. 72 homeless individuals that left the Mass-Cass area and went into one of these sites are now living in a stable, permanent apartment, which is great news. And then currently, of the 188, as of this morning, individuals staying at the 6 sites, 150, or 80% of them, have created a housing plan working with a housing professional. And these are folks that are dealing with mental health issues, substance use disorders, trauma, like many, many, many issues. So the fact that they're meeting on a very regular basis with housing professionals and counselors is a very, very important first step. And 112, or 60% of those right now at the sites, have a housing resource in hand. They either have an apartment that has been identified and is waiting for them, or they have a source to pay their rent, which means they are going to move on soon. And the reason that this is very important is we need those sites. We need those sites to move new residents in from the Mass CASS area. Now, the vast majority of these activities, the housing resources, the services, are being paid by some of our federal funds. We're really putting to good use our ARPA funding and others to make sure these residents are safe. And I just want to close by saying once again, this is some of the hardest work that I have witnessed, and I've been doing housing and affordable housing policy and programs for a long time. So the fact that we are able to point to these results, I think, really is incredibly significant, and I think it is certainly a model that we can ask the state and other communities to replicate. Thank you. I'm calling it Mike Brohl, I believe. Thank you.
Thank you, Sheila. So my name is Mike Brohl. I'm here with the Boston Public Works Department. I'm here just to quickly speak about some of our actions down there in this area. We do, as the mayor noted, touch the area 19 times a week, scheduled cleanings. That involves a street sweeper, some crews to pick up some bulky items. We've got 4 of those events are actually well coordinated through Tanya's team, Boston Police Department, Street Outreach Unit. That allows us to really get in there, get some bulk items. I should also note the work with Sue Sullivan and Carol Costello's New Market Bid Association has been very helpful. The support both from them and that we hope to share with them as well when they reach out. That number 19 probably grows to about 25, 26 if we're being honest. Those are unscheduled but on the fly quick cleanups of areas that may have become or becoming close to an encampment. We try to get ahead of that, get those off the streets as soon as possible, again, with the work of all the teams that Tanya has mentioned. I think when we talk about historical numbers, where it's tough to do in trash, the action on January 12th saw us remove 43 tons of material from those hardened encampments along the Triangle and Atkinson Street. For a frame of reference, on a heavy day now, when we're down here, we're talking about 1/10 of a ton, so 200 pounds. That is, the problem here is not trash, but we're trying to do our best to make sure the problem doesn't become trash and doesn't become the encampments. And I think with the good work of Tanya's team, we are able to get ahead of things, have conversations. It's not a perfect world. We don't play in a perfect game in trash and recycling and keeping streets clean. And of course, there are some challenges in this area. But I think with the help of the coordinated team, I'll say it, I had the pleasure to have the mayor in my car a few Friday mornings ago for a 5:30 ride to look at some troubled hot spots and kind of talk about what we see in the field. Was extremely helpful and was able to share some ideas and some comments. And I think, the men and women of Public Works have a keen eye to the area. We inspect the area ourselves multiple times a day to see what we see, if there's a problem, if something popped up. We're in constant communication on text messages, emails, phone calls to kind of get ahead of that next troubled spot before it becomes the troubled spot. But again, the time and attention that we're putting to this area obviously isn't enough. We see litter in the gutter, we see trash, but our efforts are there. And if we have to be there 40 times in a week or 5 times in a week, we'll be there. So I'm now about to have to Ryan Woods.
Good afternoon, everyone. My name is Ryan Woods. I proudly serve as the Parks Commissioner for the City of Boston. I'm here to talk about all of our parks, but specifically Clifford Park, right across the street from the Parks Department headquarters here at 1010 Mass Ave. We're very grateful to be part of the coordinated response team every morning on a call with all of our colleagues that are here behind us to come up with the best methods to make sure our parks are safe, clean, and welcoming spaces. I'd like to walk you through what's happening in our park. The hardworking staff of the Boston Parks Department start their day. This is the first park, Clifford Park. They start in each day between 7 and 7:30. They also return there before the Mason School gets out every day, just before 2 o'clock. In addition to that, we have the public health recovery services that go through the park at least twice a day, and we're very grateful to the New Market Bid that makes at least 3 sweeps a day through the park. So in addition to the Parks Department's work that they do, there's at least 5 sweeps every day through Clifford Park. We recognize that the park should be a safe space for our youth, our families, our neighbors, and a great more needs to be done. we're excited to engage with the community on a complete renovation and redesign of Clifford Park that will be coming up shortly. And we want to thank everyone behind us for being part of this team to get it done. We're grateful to the community for supporting our work and to make sure that all our parks are safe and welcoming to all. And with that, I have the pleasure of introducing the Executive Director and our partner at the New Market Bid, Sue Sullivan.
Good afternoon. Thank you, everyone. And I think I'm very appreciative that they had me speak this afternoon because I'm the one person who doesn't work for the city, and they're never quite sure what I'm going to say. So I appreciate that. I am the Executive Director of the New Market Business Improvement District. I actually represent the property owners, the businesses, and the residents in the area. And we also are proud to partner with the city in the efforts to improve the quality of life down here in the area with for everyone who's living on the street and for everybody who works here and lives here. We have a crew of about 25 to 30 individuals right now who are out here every day doing street cleaning, and every one of them either lived in a tent 10 months ago or was living in the shelter or have come to be on the street in recent months. And they are now working their way into a better place, a state of recovery and better housing, and all thanks to our partnerships with the city. What I will tell you is, if you talk to businesses down here, you talk to residents, you know, a lot of people will tell you that it's still bad. Things are bad. You know, they're not, you know, we've got people on the street, we've got this, we've got that, I can't do business. And they're not wrong. Okay, but they are wrong. If anybody says there's not progress being made, they're wrong. They've got very short memories. They're forgetting back to 2014 when we had hundreds and hundreds of people on the connector and people falling in the street. They're forgetting back to last year when, and I think the city gave, you know, the number of 90 tents or so. You know, I counted up to as many as 170 tents different times, whether it was here or New Market Square or the connector, or because they were all over, okay? Today, we don't have that. What we have, and the move this morning went as well as I could have possibly anticipated. The individuals on the street moved calmly. They moved, I'm sorry, this was the move yesterday morning. They moved calmly. They knew what we were trying to do, and they moved on to Atkinson Street, and it went very well. Are there glitches? Of course there are going to be glitches as you're trying to figure things out. But what I'll say is this morning, when we got there and we were doing street cleaning and movement and all again, it again went smoothly. And were there tents overnight that went up? Absolutely. The 20 tents that Dr. Ajakutu talked about, I think that's who talked about it, they went up. They came down this morning, and they were removed this morning. Will they go back up tonight? Maybe. But the goal of the city is to make sure that that as we move to clean people every other day and all, that people will begin to realize that it is better for them to go inside. The whole goal is for people to go inside, go into treatment, go into recovery, get housing, get shelter, so they're not out here in these tents. I saw the really bad things that happened in those tents a year ago. And I know that our mayor and our public health officials and our police, all of whom are out here every single day working really hard to make these changes, okay, want the same thing. They want better for everybody out there. Now, what I will tell you is that the only way this is going to happen in the long run is that partnership with the state that I think you heard 2 or 3 different times already, which involved other communities, other towns and all, taking responsibility for this as well, not sending everyone here, not saying Boston can solve your problems, because Boston actually does a pretty good job of solving its own problems, but you can't take everyone. So somewhere along the way, the state either has to incentivize or penalize other communities and all for not for hey, can they just take a piece? Can they take a small treatment center? Can they take 3-decker units of affordable transitional housing? We're not asking people to take the world. We're just asking everyone to do what's right. The second part of it is that we need to stop the open-air drug trade, and everybody knows that. That's a good reason why everybody comes here. Okay? And yet we also, in doing so, it's not all on the police, it's not all on public health. It's got to be a combination that everyone working together to get people to where they need to be so that we don't have to have that open-air drug trade out there. I've probably gone way over my time. There are some people out there who cannot think for themselves. I know that questions of treatment, versus arrest and all are an issue. But I'll tell you, I think the DA has the right idea on the SOS program, services over sentencing. It's worked for some of the members in our work group. And I'd like to see some of that as well. So, Mayor, I'm sorry if I went on a little too long. But thank you. Thank you for all you're doing.
I think we got everyone in. Any questions? And it could be for anyone.
You asked for resources from the state for 1,000 units and also for help with this. How much is the city spending on this, and what response have you gotten from the state?
Yeah, so just to put a little more detail into some of the numbers that I shared earlier, we really have, it is inescapable when I am spending time at the engagement center or on Atkinson Street or near Mass and Cass. When I speak with individuals, you hear life stories that are so similar to the stories of our own family members, and you also hear life stories of people who are coming from all around the country, in some cases, to this area. We know that this is a statewide challenge, and that as long as this is a statewide challenge, Boston and our residents will continue to bear a significant share of that. The estimates statewide are that there are about 8,000 unsheltered individuals, and we know...
Sorry, 8,000 homeless.
Oh,
and then
okay. Sheila's going to correct me in 5 seconds, but I'll try to do the broad numbers, and she will make sure that it's totally accurate. 8,000 individuals who are counted in the state system around homeless individuals in terms of when there's interactions at the shelter or documented need. We know that between 5 and 10% of our general population of residents who are homeless are in this intersection of homelessness, mental health, and opiate use. And so we could absorb as a state probably 600 units of low threshold housing like that today. And as we've seen at Mass and Cass, residents, there's a flow from other parts of the region. There's shifts and ebbs and flows within the situation of residents right here in our community, and so to have that flexibility, that is the goal that we believe would be able to help Boston and all of our communities truly get to the root of this challenge. We are not stopping at the 200 units or the 192 units that Boston has created. And again, in a matter of just a few weeks leading up to that January 12th housing surge and removal of the encampments, we found 6 sites, and they're all within the city of Boston, and we continue to explore sites that are outside of this area so we can continue to try and decentralize the situation, doing everything that is possible within our power. But in 10 months, it's been very clear that there is only so much that is within our power, and we have to be honest about these limits and what municipalities' role should be relative to their state partners. We are going all in on case management, connecting people to services, looking to reunify families and identify where centers of support exist for individuals who find their way to us. And we're going all in on continuing to add to our portfolio of low threshold housing. But that is the scale of commitment and partnership that we need from the state to truly address this.
Have you made a formal response to this? A formal request to the state, and what response have you gotten?
We've had we're in constant conversation with the state about various situation. You know, the spectrum of support and kind of the overlap of housing and healthcare and treatment. What I'm highlighting today is really low threshold supportive housing, the type of housing that we see at the Roundhouse, for example. There's also hundreds of units that we are in need of for permanent housing, the type of housing that those 72 individuals have accessed largely outside the city of Boston through pipelines and through the state's existing system. More permanent housing would then speed up the pipeline and the barriers that are keeping folks in shelter and in low threshold housing as well. Partners like the Pine Street Inn are working to site hundreds of more units within the city of Boston, and their estimate is that if all goes well, there may be across the region 500 new units within the next 5 years of permanent supportive housing. Again, not low threshold supportive housing, but permanent supportive housing. So we are constantly working with the state on all pieces of that. This has been a priority that I've elevated also with Metro mayors as well. I'm proud to co-chair the Housing Task Force on Metro mayors alongside Mayor Arrigo. And we all feel the sentiment. Whenever I speak with fellow mayors, everyone knows that at the city level, we are problem solvers. We are going to do what we can. And everyone understands that this is a collective challenge that we can take on together. But we need that coordination and commitment from the state. Our units, our 192 units, were funded in large part through ARPA funding and through state funding that the state legislature was able to secure for us. So that scale of investment pays off in multiples in terms of the costs that are then avoided for residents in the healthcare system, in public safety, and in neighborhood quality of life and everything else. But we need that scale of investment coming from the state, and we'll continue to press this, especially as this gubernatorial campaign is wrapping up and we'll see a new change of administration as well.
Mayor, there was a lot of the criticism that in decentralizing the services, you've also decentralized the problem to places like Clifford Park, where people say it's gotten worse since you took office, and perhaps to Franklin Park, where Jean McGuire was recently attacked, and people say the issues there are also seeing an overspill from mass and CASS.
Yeah, I think it's really important. You know, we are now, I think, using the term mass and CASS as shorthand as a city for this set of challenges rather than just a limited geographic area. Right? There are no boundaries on the work that Tanya and her team are doing, and they are, and Basola and the public health outreach folks are in Franklin Park on a daily basis. They're in Clifford Park. They're in spaces all across our neighborhoods. We know that there's a direct impact on Nubian Square and residents of Roxbury, on residents in Dorchester, and we are all affected by this, again, regional, statewide, national challenge. I think you heard earlier that the efforts targeted to Clifford Park in particular, recognizing that this has been an epicenter of the immediate impacts, have been very productive and effective, and community members are a huge part of that in the teams and organizations and leaders who continue to draw attention to this and highlight and roll up their sleeves and get right in there to help with cleanings and sweepings and to fight for better lighting. That is why this park is in the pipeline for major renovations as well, that will see new lighting and new infrastructure. We have seen tremendous turnaround at Clifford Park. It is nowhere near where we should be in terms of the impacts, right? I've connected with families who have been impacted, and it's for a young person to experience being pricked by a needle in any of our spaces is, we will take every possible step so that all of our parks and all of our public spaces are what our kids deserve. The reality of the situation is that we need to keep making progress every day, and we're not all the way there yet by any means.
But there was one of the side ways that it took too long, and one of their complaints was, yes, we're seeing the cleanup now at Clifford Park, but it took too long. I mean, the park had to be closed not too long ago. So they're saying, what's taking so long? They want to hear more of the numbers. They want to hear. They think you're not listening to the community. That was formal closure. Right?
Yeah. So the city never closed any of our parks. We recognize that from the community's perspective, there is when I'm with my kids, I feel that the type of anxiety, if you don't know a situation is totally comfortable or safe, as a parent and as a coach, I completely appreciate and respect the passion and the emotion that community members are feeling, because this is our day-to-day experience for far too many of our young people and community members, having to absorb some of the impacts of this nationwide opiate crisis. And so we are moving as soon as the you heard from the team. It's not as if there's been an on-off switch on any of this from day one. It's been new strategies, new approaches, looking to figure out how we can direct our resources in the right way. There was not a kind of sudden focus on one part or another. The cleanings, we've arrived at a rhythm that seems to work for particular parts and particular areas, just given the rhythms of when the park is used by on the street. But we continue to troubleshoot every possible situation we can, not just in Clifford Park, but under some of our bridges across the city, in other parks and open spaces. We'll continue to take that focused approach wherever we can.
Mayor, who is not saying?
Is there anyone who didn't ask a question yet? Okay.
So who at the state can you say is not saying yes, that you want to say yes? Is it the legislature? Is it the governor's office?
So, I am really grateful. I want to emphasize the state has helped us get to this place where we are, where we know now with complete clarity what works and how effective it really is to have this model. We would not have been able to stand up 192 units in a matter of weeks and months without their direct daily communication with us. That was a much more targeted effort designed to remove and address a crisis of an encampment. You heard 43 tons of materials, wood pallets, propane tanks that were causing fires on a very regular basis. The fire department was rushing in, and we were seeing the safety impacts for everyone from that. And so we've seen what's possible when the city and the state really collaborate in Boston. We need to see the same level of collaboration and investment in cities all across our Commonwealth as well, because this is not a challenge that is unique to Boston. I hear from my fellow mayors that there are residents and open spaces that other communities are working on every single day as well. So we need this to be a part of the conversation that we are all having together, where cities can truly have an impact and where the state government in various systems can have an impact.
Thank you.
One from each.
Okay, sorry. Where are you getting the information?
We'll just do Tori and then Sean, and then we're done.
Okay. Where are you getting where do you collect, how do you collect the information that people are coming from out of state, right? So where is that data actually coming from? Can you talk about this? Sure.
Hi, so we do point-in-time surveys. So this is self-report. We get it from people on the street. Our street outreach workers have gone out both at the end of last year, then in May, and then we recently completed a survey. So the last data that you have that's actually posted on boston.gov is from May of this year. And at that point, we asked people where was their last permanent address. And that is where we're getting the information that a considerable number of people are actually residents of other places outside of Boston. We will have more data with this updated survey early next week, and that'll give us another point in time of exactly where people are coming from, as well as other important demographic data, some of which I gave earlier.
Just about the transparency part, like you talked about, what else is being done besides putting stuff on the boston.gov website? Because I know that's not on the. Talk about.
She's having community meetings, so Tanya's going to take that part.
But will that be available? That specific data point?
Absolutely.
Okay.
We'll put all of that data on the website.
Okay, great.
If the mayor and Dr. Ojikutu could respond to the criticism over the AHOPE's distribution of pipes, syringes, cookers, and that sort of thing.
Yeah. The state-funded programs that the Boston Public Health Commission and many of our community partners have been working on for the past 30 years have helped save lives and have helped reduce the incidence of transmissible diseases that put our entire city at risk. Residents who are unsheltered and living with substance use disorder are at greater risk of certain types of transmissible diseases, and we know the data has shown that when there is an ability for mitigating that risk, the benefit flows to everyone. that is a piece of the larger collaboration that you see. And so we are going to continue to take every action that we can to save lives, to reduce the risk of public health risks for everyone within the city, and to show and be transparent about what the numbers look like. I think I have some figures on this potentially, but in terms of the AHOPE program, on a regular basis, the program is an exchange. So the goal is not only to provide sterile, hygienic materials that will stop and reduce the spread of disease, but also to take in used needles so that they are not ending up on our streets. And so on a regular basis, there are far more needles and syringes taken back in than given out. And so even, for example, in September, 73,696, a little over 73,500 syringes given out in September, 200,000 collected back in, 202,079. And so that is pretty typical of the type of pickup and flow. The reality is that this is an illness, a medical condition that individuals are living with, and we have to take every possible step from providing the ability and stability to get on a solid footing to continue accessing treatment and services, to focus on what works, resource that, and like other cities across the country, those strategies are an important part of what we do. Okay, thank you, everyone.
On another topic, Commissioner Cox, a person of interest has been identified in the stabbing of Gina McGuire. From our understanding, can you address that, relief to the community, or did the putting up the photo that you had of a person of interest help in this case? Can you answer?
Beth, can we just, if everyone else wants to kind of break, we'll take some questions on, kind of recent things if folks want to kind of break up. That's up to you guys.
Thank you. Thank you all. Oh, okay.
Can we get that?
We're all here. I think everybody wants to.
No, well, we actually.
No, that's fine. I'm just saying that they.
We unfortunately, I was just going to announce that. So we actually have a clinic here where we're doing COVID vaccination and testing. So we actually have to leave soon. I mean, I'm sure there are some immediate questions. Yeah, sure. If you could go ahead.